Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by Holy Name Medical Center in Teaneck, New Jersey. Healing begins here. TD Bank, Johnson & Johnson, Community Food Bank of New Jersey, New Jersey State Nurses Association and the Institute for Nursing, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation, and by Rowan University, educating New Jersey leaders, partnering with New Jersey businesses, transforming New Jersey's future. Promotional support provided by NJ Advance Media and by the New Jersey Business and Industry Association.
Welcome to State of Affairs. I'm Steve Adubato, coming to you from the Agnes Veris NJTV studio in beautiful Brick City, Newark, New Jersey. We're pleased to welcome, for the first time, Les Hirsch, Interim CEO and President of St. Peter's Healthcare System. Good to see you, Les.
Steve, happy to be here with you this morning.
You and I have had a whole series of conversations off camera about the state of healthcare. Where are we today, and how has competition changed?
It's dramatically changed. I'd say that the biggest factor driving change in healthcare is really the cost. In this country, we're the most expensive of any industrialized nation in the world, about 17% of gross domestic product. And if something doesn't change over the next 10 years, it'll be over 20%, and healthcare costs are projected to increase about 5%
Why is that a problem?
year. Well, the problem is, just in terms of the size of it as a percentage of the economy, it's just huge. I mean, we are much greater. So, what we see today is a push to drive costs down, and then you add science, technology, and healthcare delivery is changing. I mean, I work in a hospital and have for almost 40 years in different hospitals, but hospitals are no longer necessarily the center of the universe when it comes to healthcare. There are many other competitors that we have today. The way healthcare delivery is changing, different
Example, we were talking about the CVS piece. I tell you, at our CVS in town,
yeah.
you can do what you have to do in a regular CVS, but then they got this clinic.
Right, and if you think about it, I mean, when we grew up, we remember neighborhood pharmacies, sporting goods stores, any kind of neighborhood store, and then the big box stores, and it became very corporate. Well, now those same organizations, they have clinics. They're seeing millions and millions of patients a year in these clinics. What potential, when you look at Amazon, a company like Amazon, with all of its reach, and when you think about access to a population, and if you tie an Amazon together with an insurance provider, I mean, who knows, how the future will turn. But healthcare delivery is changing dramatically.
How tough to lead a hospital? You have to make tough decisions about economics, about the number of employees you have, about just keeping costs down while providing quality care. Talk about that balance.
Well, it definitely is a balance, because we're not in a usual industry and situation where price is set by contract. We can't control costs completely in terms of the supply side, pharmaceuticals, medical supplies. And then, in our case at St. Peter's, we are one of the few remaining independent hospitals.
You're not, excuse me for interrupting, you're not part of a larger system.
No.
There are some very large systems in the state.
Oh, yeah. The consolidation in New Jersey has been extraordinary, in fact, unprecedented. We are an independent hospital. We're actually a Catholic hospital. We're in our 110th year in New Brunswick.
By design?
Catholic hospital
No,
by design?
Catholic hospital freestanding, meaning alone. Best strategy?
Not necessarily for the future, but we're in the process of looking to our future. But again, we are one of 7 hospitals in the country that are sponsored by a diocese. We're sponsored by the Roman Catholic Diocese of Metuchen. But whether you're a Catholic hospital or not, as an independent hospital today, you have to think about how and what you'll do in the future. So in our case, we're presently in the process of planning, looking to our future, but there's no doubt about it. We live in the land of the giants, and healthcare has changed remarkably. When I came into the industry years ago, there were over 90 community hospitals. Today there's 71. 58 of them are part of a larger system, and some of these larger systems have, for instance, 8 to 10 times the scale we do.
Les, what do you think it all means for consumers of healthcare who are looking to make the best choices for themselves, their families?
Well, I think ultimately what our responsibility in healthcare is obviously to provide a safe and effective environment for our patients and really assure access. And I think that's one of the biggest issues today is access. If you look at our country, we still have millions and millions of people that are uninsured. Even though the Affordable Care Act helped with that, many, many millions of people, certainly hundreds of thousands in New Jersey with the Medicaid expansion, got access to organized health care. So really you want quality and access and affordability.
You know, real quick, we're going to another segment on this show. Jackie, right, we're doing a whole opioid crisis segment on this particular edition of State of Affairs. You have an initiative over at your place.
Absolutely. And St. Peter's, one of the things we do as a community hospital is outreach. And so we've recently established an opioid initiative. We're working collaboratively with school systems, superintendents, parents associations, the police. We have a program, I could share this flyer
forum coming up
with you that is a flyer about a program that is available. We're working collaboratively with Chief John Zabrowski in the Saraville
in the police department.
Absolutely.
What are you looking to accomplish through this?
Well, I think first and foremost is education. I mean, we recently had a program in one of the schools with 1,500 students, and I think it's safe to say now that, I mean, it's very familiar for all of us. You know, we all know someone who's had heart disease, died of cancer or heart disease in our family, friends, and everyone. I don't think anyone could say they don't. And unfortunately, we're finding the same thing now is becoming true, that all of us, it seems, know someone who had an issue or lost a child. And, you know, just recently, you know, one within our own hospital family, you know, had the same thing happen with a child. So it's truly a huge epidemic, whether it's, you know, the heroin addiction or the narcotics, you know, the opioids.
Yeah.
Even in the way we treat patients, we're looking at that very closely.
What medication you give them, how long they have the drug, the prescription
and even
drug.
trying to do things in different regimens to control pain that are not necessarily opioid-based. So there's a lot of that going on, and especially at St. Peter's, you know, we're looking very closely at that.
Les, finally, in 40 years, just a few changes in the healthcare industry?
The only thing that hasn't changed is I haven't gotten older.
See? Same here. Nothing's changed in the media industry either. Listen, Les Hirsch is the interim CEO and president of one of the few, not that many, freestanding, if you will, not part of a larger system, hospitals. In fact, it's a Catholic hospital based in
New Brunswick.
Got it. St. Peter's healthcare system. Les, thank you for joining us.
Steve, thanks so much.
Appreciate it.
All right.
State of Affairs will be right back. I'm thinking it will be right after this.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
Steve Adubato here in Atlantic City at Atlantic City Convention Center. This is the 2017 NJEA Convention, the 164th time this has happened. We are honored to be joined once again by the Executive Director of the NJEA, Ed Richardson. Good to see you, Ed.
Thank you, Steve. Thanks for being here.
We should say we're taping this just a few days after a historic event in New Jersey. There is a new governor coming in, Phil Murphy. Thoughts about that?
He was just here. And
he was just at the convention.
He was at the convention. He stopped by, delivered brief remarks to a packed audience right here on the exhibit floor. His voice is a little wavering, as can be expected, but it was truly energizing. And I think our members are genuinely looking forward to working with new leadership in New Jersey. He's got some bold ideas, particularly about education. He said this morning, job one is that we need to fully fund our schools, which has not been done in the last 8 years. He did. And
what kind of reaction did he get?
Standing ovation. Everyone spontaneously stood and applauded that because our members understand that for the last 8 years, our schools have been desperately underfunded, and yet, through their perseverance, our schools are still top performing in this nation. And so that's just, it's a testament to the work of our members all over the state.
Politics is something that the NJEA is involved in many ways. The number one thing is to be advocates for teachers, for educators, but you pick your spots. When you make a decision with the Senate President, which we talked about last year, right, to get involved in that campaign, explain to folks the rationale.
Well, first of all, it's not my decision or even
the organization.
Right. We have elected leaders who come together in a screening process, and then an even larger body, 125 members, who vote on those decisions. And over the course of his time in the Senate, there have been times when we have endorsed Senator Sweeney, times when we have not. And but there have been major decisions that have taken place directly affecting our members, directly affecting their work with students, directly affecting their pocketbooks. And time again, they've been disappointed by many of those decisions. And so, not an easy thing, obviously, to to go into a campaign where we've endorsed the opponent of the Senate President, but that decision was made and we stood behind it. Now, in talking with our members here,
what's the attitude?
They get it. They understand that we had to take a stand.
Was that what it's about, taking a stand?
That's what it's about. It's about again, advocating for the interests of our members, advocating for the interests of our public schools, and sending the message that we're just not going to allow those interests to be constantly undermined. That when we need to, we absolutely will stand up for our members and our students in our schools.
A couple of things to disclose. The New Jersey Education Association is a major underwriter of public broadcasting in the state, of our programming, and I just want to put that out there. Ed, but let's stay on this whole question of involvement. So interesting. Explain to folks that, how many members is it, over 200,000?
Over 200,000, yes.
The leadership of the NJEA, right? You're on the staff side, you've got this terrific group of people moving up on the elected side. The decision-making process, how do you engage folks with such a large constituency?
I often describe this as sort of painfully democratic because...
Painfully?
Yes, because running a democratic organization of that size is difficult. And yet, that's been our tradition, that's our history. Tomorrow, our policymaking body will meet. They meet 5 times a year. It's, again, another group of 125 people elected by members from all over the state. And they come together and they set the positions on all of the key issues.
How's spirited the discussion?
Sometimes vary.
Different points of view?
Different points of view, obviously. You mentioned that, I'm on the staff side of the organization, but I'm accountable to an elected board of members. We have an executive committee of 28 people, again, elected.
You answer to them?
I answer to them. I'm appointed by them. They approve my contract. So we are a member-governed organization, and we never forget that. And our elected leaders, the 3 full-time officers, elected at large by the members of the organization.
So the president, the vice president, and the secretary-treasurer?
Correct.
Well, so let's do this. If you were, in terms of agenda, you did talk about fully funding, but I want to move to the other question. I shouldn't say the other question as if it's so obvious. We were here with Ed last year, and we did talk about the pension crisis. Mm-hmm. Is that the right word, crisis? The public employee pension crisis. Is it the right word?
Depends on how you look at it. Is it a crisis in that it's going to run out of money in a year or two? No. We have forestalled that to some degree with some of the funding that's been appropriated. But in a broader sense, yes, because every member of NJEA, every public employee, we always say has never missed a payment. 7.5% of salary comes out of the paychecks of every one of our members every pay period. And over the last 20 years, the state has just uniformly failed to meet its obligations.
Sometimes called a pension holiday.
Pension holiday,
really,
I think that's a euphemistic term.
Yeah. What does it really mean?
It's an abrogation of responsibility is really what it is. And not just us saying that. Governor Christie's own Pension Study Commission said that that over the course of multiple administrations, multiple legislatures over the last 2 decades, that the state has just failed. And
what happens, sorry for interrupting, Ed, what happens when that happens?
Well, essentially the contributions of the employees just aren't adequate to sustain the fund, and it does eventually run out of money. Now, so that's a very scary thing, not just for the people who are relying on that for their retirement security. That's a scary thing for the state of New Jersey, because the state Supreme Court has repeatedly affirmed that those people are entitled to those benefits no matter what. If the state were if the state had to pay those obligations directly out of the state budget, it would cripple the state, and no one wants to see that happen. So we need to get back to responsible funding. We can do that. We can transition into it and get to full payments and get the system healthy again so that we never have to worry about that day.
Final question. The biggest misconception, I ask you this every time, but I still want to get at this. The biggest misconception about educators is?
I think it's that whole, 9 to 3, summer's free mantra. I don't know a member who only works from 9 to 3. And in terms of the summer's free, well, our members only get paid for the time that they work. More than 2/3 have other jobs. And what's really exacerbated that is a law known as Chapter 78.
Yeah, we talked about that before. Real quick, what that is?
It basically forced massive employee healthcare premium shares on our members. Completely cut through collective bargaining and any other process. It's just state law requires you to pay X. Now, this is a profession that has already been identified by the Economic Policy Institute as behind their peers on a total compensation basis by 10%. All in, when you factor in differences in the work year, differences in their retirement security, and 10% behind. And so members are hurting as a result of that. Many of them taking home less net pay in September than they took home in June. And we have to change that.
And so look, so you're saying in the new administration, the new government in Trenton, you're looking to change this?
Yes, absolutely.
Thank you.
We just need to level the playing field.
We appreciate you joining us. We appreciate the NJEA allowing us to be here at the 164th annual convention. And
well, we very much appreciate you being here. Thank you again,
Ed.
Steve.
Well done.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
State of Affairs is pleased to welcome once again Angelo Valente, Executive Director Partnership for Drug-Free New Jersey, and Christopher Jakim is Assistant Special Agent in charge of Drug Enforcement Administration's New Jersey Division. Good to see you guys.
Nice to see you, Steve.
Ange, we've done this before.
Yes.
We've talked before in forums, if you will, Chris, on the subject. Where are we right now with the opioid crisis in the state of New Jersey?
Well, I think we're making tremendous strides. I mean, we have been able to bring this epidemic to the public light. People are aware of it, and we've made some legislative strides that have also been really helpful.
The biggest?
I think the biggest was limiting the supply of medication to a 5-day maximum for a first prescription, and also the notification. The fact now that patients that are leaving doctors' offices are going to be aware of the addictive qualities of the drugs and also what alternatives might be available that are non-opioid.
Chris, we've been at this before. You see it from another perspective. How concerned, how aware do you think the public is at this point as to how serious this crisis truly is?
I think that awareness piece continues to grow, and we've been doing great efforts on trying to promote that and get the word out. From the medical community, doctors' awareness as far as their role in this epidemic, their prescribing habits, their ability to talk to their patients about the addictive nature of the opioids that they're prescribing. To Do No Harms, that we partnered up with the Partnership for Drug-Free New Jersey, has addressed over 3,200 doctors throughout the state of New Jersey. This is a symposium that we started back in October of 2013, and it's had great success to look at the outcome of what the doctors are saying after they've attended these symposiums.
You see big changes in doctors? We've had this discussion before, Angelo, and early on I was like, well, they're not as on board as we'd like them to be. 5 years later, after we started these forums, where are we?
I think we see a tremendous shift for a number of reasons. First of all, the CDC has provided guidelines. And these guidelines...
The Centers for Disease Control. Why are they relevant in this discussion?
Well, they're relevant because they have provided empirical evidence about what needs to be done in order to address the epidemic and reverse the epidemic. And what that evidence has shown is that some of the information that we've been providing, most of the information we've been providing, has been very accurate and consistent with what the CDC has now come up with as a way to address the problem. So I think a combination of seeing the federal government involved, certainly seeing the doctors engaged in attending these events, has been a tremendous help in addressing the epidemic.
We're doing this program at the end of the Christie administration, moving into the Murphy administration, if you will. Governor Christie, a leader in this effort, together with President Trump, they hold a Washington summit on this. So the president's saying that this is a national, I gotta get the language right. He said it was a crisis?
Public health epidemic.
Okay, what's the difference between a public health epidemic versus a crisis? Is there a difference?
I think that it was a step in the right direction, Steve. I think that no question about the fact that there needs to be funding that supports that
Is there funding
crisis.
from the federal government to do this, or as I heard that announcement, I didn't hear or see anything about money?
Well, I think the funding is going to come through the Congress and also through the president and his initiatives that he wants to create. So I think we're going to see that come down the pike.
Money for what?
Money for treatment, money for prevention, money for continuing providing long-term rehabilitation. So I think it's a combination of looking at all the different aspects of the disease and coming up with ways to be able to address it.
Governor Murphy will, in fact, be dealing with this. He is concerned, I'm sure, as a lot of other public officials are. What advice would you have for him?
I would say that he has to keep up this fight and champion this cause. He can't just turn his back on the opioid crisis itself. He has to lend extensive resources for treatment, for prevention, and be a champion for this cause and carry that torch forward.
But I want to be clear, there's being a champion in terms of your public rhetoric, and then there's money. You got to make this clear for folks, Angelo.
Right.
The public awareness effort, and we've been involved in the past in
Yes.
public awareness efforts, that's one thing. But the dollars, state dollars, federal dollars, it's critical.
There's no question about that, Steve. We need to have the resources necessary in order to address this epidemic. And the resources have to be available for all different levels. Certainly prevention is key, because if we don't stop this from starting, then I think we're going to see a continuation of the numbers, significant numbers.
Sorry for interrupting. I heard the president say, you know, and he told about his own experience. He said his brother had an alcohol problem, who he obviously was very close to. And he said, but you know, for me, drugs are never my thing, alcohol is never my thing, so the key is you just don't start. Respectfully, I thought I had heard that from Nancy Reagan, the former First Lady, when she said, just say no. Is that a strategy?
Well, I think it's part of an overall strategy. Certainly prevention is key, but certainly we need to be able to address those individuals that are already dependent or addicted on heroin, and we need to be able to get as much treatment options as possible. We need to be able to look at long-term recovery. We need to be able to support families that are dealing with this on a day-to-day basis, because we know this is a disease that not only impacts the individual, but impacts everyone around them. So we need to be able to support those programs, and that will cost money. And I think we see now in New Jersey, there's been a commitment on the part of the governor and the legislature to be able to provide funds, and I think we're going to see it on the federal level.
Chris, real quick, the states are actually starting to, quote, sue certain pharmaceutical companies. Explain that.
They are. They are. So, I mean, an individual state, it's up to their discretion as far as the price that they've paid based on this epidemic, as far as the amount of deaths, lost wages, health care costs and expenses. So they're looking at this from an objective, you know, how can they recoup some of these costs?
Excuse me for interrupting. What message does it send? I guess it's Purdue Pharma, if I'm not mistaken.
It's one of
Purdue
the companies.
Pharma, there was a process where they started to sue, government started to sue Purdue Pharma. For what, by the way?
I think it's had to do with the fact that they had information about the addictive qualities of the drug.
Did they share
They didn't share.
Okay.
And
So what message does it send? I don't know about that case. It plays out. I respect the judicial process.
Right.
What message do you think is it sending to the pharmaceutical community?
That government's going to hold them accountable, right? I think when we look at this and how we got into this epidemic, it was a perfect storm as far as everything coming together. You know, we could go back and really trace this back to 1996 as far as, you know, pain management, you know, chronic pain as pain as a fifth vital sign, and how medical community is going to treat that. The role of the pharmaceutical companies and how they aggressively marketed these strong opioids and narcotics to not only the medical community, but the public in general. And then the role of the trafficking organizations and how they stepped up, and the role particularly of the Mexican trafficking organizations and their transportation and distribution methods throughout the United States.
Final moments, how confident are you, Angelo, that we're going to continue to make progress here?
Oh, I think we're very much on the road of recovery. I think we're making progress. I think people are becoming more aware of this issue. I think we're also breaking down the stigma that many people face, many families face.
These aren't criminals. These are people who have a problem.
Absolutely. This is a disease like any other disease. And if your child comes home and had an issue with a potential...
2 seconds.
We need to be able to make sure that we tell everyone across the state and across the country that if they need help, get help, and more importantly, look at alternatives to opioids.
I promise we'll continue talking about this issue on State of Affairs. Thanks for joining us, folks. Thanks, guys.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Varus NJTV studio at 2 Gateway. Funding has been provided by Holy Name Medical Center in Teaneck, New Jersey, TD Bank, Johnson & Johnson, Community Food Bank of New Jersey, New Jersey State Nurses Association and the Institute for Nursing, New Jersey Sharing Network, and by Rowan University.
I cry when I'm hungry because it's really hurtful to my stomach.
When you feel sad that you don't have food, like at the table.
I feel weird because my tummy starts grumbling.
Sometimes all that makes you feel better is food.